Hope everybody's having a great afternoon. Thank you for coming out. As Jake said, my name is Miguel Johns. I'm the founder and CEO at KingFit, and KingFit is an innovative health and wellness technology powered by artificial intelligence. So why KingFit? Well, I've spent half my life around type 2 diabetes. My father has it, a couple of cousins, a couple of uncles, and my grandmother as well. Funny story about when my grandmother was diagnosed with type 2 diabetes. She went to her physician who referred her to a diabetes educator, and her diabetes educator told her she needed to be taking the medication, but she also needed to start living a healthy lifestyle. So my grandmother knew my background and was extremely excited to tell me that she was going to be living a healthy lifestyle. She was going to completely cut pop out of her diet, and from now on, she would only consume fruit juice and chocolate milk. Now, I didn't have it in me to tell my grandmother that those were not healthier options, but I did want to find out how many more individuals there were, like my grandmother and my father, out there in the world today. And this is what I found. There are nearly 30 million type 2 diabetics in America and another 86 million pre-diabetics who, if they don't make a lifestyle change, will eventually become type 2 diabetic. We spend over $300 billion every year on type 2 diabetes, and this caught the attention of the Center of Medicare and Medicaid. They gave the YMCA an $11 million grant to conduct research to find out how much they could really save if a few of those pre-diabetics did not become type 2 diabetics, and they found that for every individual who avoided type 2 diabetes by going through a lifestyle change, they saved $2,500. We've seen this as an opportunity to create an innovative health and wellness technology, and we're going to deliver this technology through 4 pages. The first page you see there is the profile page. This allows an individual to connect to their friends and family for additional social support. They can unlock achievements based on their engagement and their progress. And the most important part of that, they can connect to a healthcare professional who is delivering the services that their physician referred them to. The second page is the data page. This page connects to your wearables. It allows you to see your biometrics in real time, see how your decisions are affecting your overall health, and our end goal is to get that page to connect with EMR systems as well. The third page is the tools page. Now this is where the artificial intelligence is involved. We're using IBM Watson Health to drive some automated clinical exercise and nutrition prescription. To give you an example of why that's so important, when I was a nutrition coach, I had over 100 clients at a time, and it would take me the span of a day to make an individualized program for one person based on their health history, everything they've gone through, and their level of health that they are currently at. With IBM Watson Health, we can do that with the touch of a button, saving health coaches a ton of time, allowing them to serve a much larger population. We have created the easiest food log available today. Everybody in here is probably tired of tracking calories and macronutrients, even if you've never done it in your life. It's a headache. We're transforming that by allowing an individual to select a food group to understand where they align with their health decisions. We know that if you have 10 cups of green vegetables in a day, you're living a healthy lifestyle. And if you're on the opposite end of that spectrum, you'll be able to see it really quickly why you're going through the things that you're going through. On that page as well is our exercise prescription. We're able to identify your level of health and then put you through a quick clinically researched test, such as the ACSM step test, to identify what your program should look like. We can deliver that program right to your phone, so you never have to leave your house. But if you are in the gym at that time, you can quickly have a resource to see how that exercise is supposed to be conducted. We're going to supply you with an exercise bank and a recipe bank where you can easily see your meal, the ingredients, how to make it, and with the press of a button, add that to a digital shopping list to take with you into the store. The fourth page is a very interesting page. This is where we deliver our own modules such as a diabetes prevention program or a next level sports performance program. But we can also license this page out to partners. As you can see there, we can white label this part of the app, actually the entire app, but an organization can deliver their own in-house programs through this page as well. What we found when we started researching this project and talking to individuals is, if you're a healthcare organization and you have an in-house solution that you're pretty proud of, you don't take too kindly to other companies coming in and telling you that you're doing a terrible job. So instead of trying to replace their coaches, we just give them the technology to improve the quality of service that they already deliver. This creates potential for a lot of different customers. We've seen that potential and we're extremely excited about it, but we wanted to really focus in on diabetes educators. Simply because 88% of diabetes education is done with paper and pencil. The diabetes educator will see their patient twice in a span of 3 months, which creates no real long-term results. They're also very interested in improving some of these metrics. The reason being, if they meet these quality metrics, they get bigger bonuses. And we can help them do that by allowing them to take on more patients and have more points of contact, which leads to better services. We can also save them significant labor costs. If the demand of the pre-diabetic population, being 86 million right now, reaches 2,500 in a specific city, it would take up to 25 coaches to deliver services to all those individuals. So most people are going out without care right now. With our technology, we drastically decrease the cost of that service, saving organizations large amounts of money over time. Based on this information, we believe that in 5 years we can capture 1% of the pre-diabetic population and reach our financial goals, delivering long-term results to both individuals and our investors. Thank you.